So, Dr. Moffitt, let's talk about national numbers first. In the past week, 204,000 children in the U.S. tested positive for COVID-19, and that's a five-fold increase from just a month ago. Do you expect the numbers to go even higher now that kids are back in classrooms?
Yeah, so with those numbers, children in the last week represented about 22% of COVID cases within that week. And that is an increase from the 10 to 15% of COVID cases that they represented on a weekly basis during our last surge, for example. And that likely is because of their unvaccinated status. It's likely combined with the easing of restrictions, and they are having more contacts, more exposures as they return to school. Luckily, the percentage of COVID hospitalizations that are in children remains very, very low. But taking all of this together, it is conceivable that we could see an increase in numbers of cases in children as they return to school. However, we learned last year that transmission within the school can remain under very, very good control with universal masking and enhanced ventilation and other layered measures in place. So I think if schools can really stick with those protocols, at least for the next few weeks as we get through this return to school, I think that we can really keep the contribution of school transmission under very good control.
Well, Dr. Moffitt, at least we know that right now, all public school students in Massachusetts are wearing masks to school. That will remain in place for those, kindergarten through sixth grade, because there's no vaccine approved yet. But then come October 1st, that's where it gets a little bit more interesting, because those middle and high schools, if they hit a certain threshold with vaccinations, I believe it's 80%, they can remove the masks in Massachusetts. So we know that kids 12 and older have been eligible for vaccines for quite some time. And there was a big push in Massachusetts to get those teens vaccinated before the school year began. Did you see an increase in that over the summer? And do we know how our vaccination numbers compare to other states?
Yeah, no, it's a great question. And we did see, especially in the last month, rates of vaccination in 12 to 17-year-olds in Massachusetts increase. Massachusetts currently is seeing almost 70% of their 12 to 17-year-olds having received at least one dose of the Pfizer vaccine, with the majority of those now being fully vaccinated. And that is excellent compared to about 50% of 12 to 17-year-olds nationally who've started the COVID vaccine series. So Massachusetts is doing great, but there is room for improvement, and it's never too late for an adolescent to start their vaccine series.
Okay, promising. Now we want to get to some questions from viewers. So Lauren writes, my kids are 5 and 7. They started school Tuesday. Do I really have to get them tested for COVID every time they get the sniffles?
I know. I would say my first response to that is you should follow your school's protocols, first and foremost. But we need to just keep in mind that most infections in children are actually very mild, and it would be impossible to distinguish symptoms of the common cold from a COVID-19 infection, particularly in a child right now, in areas where community transmission is on the rise. So I know it's inconvenient. I've had to go through this with my own kids, even recently, but the tests are so much more accessible now than they were this time last year. The turnaround time is improved, and getting those tests when someone has symptoms of an illness that might be COVID-19, even if it's mild, it's a really important component of keeping community-wide transmission under control.
All right, Dr. Kristen Moffitt, an infectious disease expert at Boston Children's. Dr. Moffitt, good to see you. Thanks for your time.
Sure. Thanks for having me.